Hello, my name is Louise Saladino. I'll be presenting to you today the issue of mandatory flu vaccination for healthcare workers. Seasonal influenza can lead to upwards of 200,000 hospitalizations and 36,000 deaths annually in the United States. Vaccination against seasonal influenza is the best prevention to reduce the spread of the influenza virus. Healthcare organizations must implement comprehensive infection control programs in order to support the prevention of the spread of the influenza virus. Mandatory influenza vaccination for healthcare workers is supported by many healthcare agencies and has been recommended by the Centers for Disease Control and Prevention for over 30 years. Join us on one hospital's journey to see that every employee is vaccinated against the influenza virus.
Today, as part of our flu campaign in the hospital setting, we have decided to do a mass vaccination drill today. And so to get us up to preparing for this drill, we've had a team that has been a multidisciplinary team that's met over the past month and a half to plan this mass vaccination drill. Part of that team's planning was also to look at our flu campaign for this flu season 2012, 2011 and 12. Our team consisted of marketing, different departments, educational services, our nursing department, ancillary departments such as food and nutrition and environmental services, and we also had an executive leader that was part of the team, and also the executive leader took part in the planning from the overall systems aspect. So she was able to bring back information from a systems aspect to our entity to look at how we could come together as a system to plan this vaccination drill. And then we are planning for the evening shift, what we're going to do at the nighttime, have vaccinations available in all the inpatient units where the peers can vaccinate each other. So that's worked really well, and we've had that in our campaign for the last several years, and that's been very positive, where it is right where the staff are at and they can get it. Even physicians or other entities can go on an inpatient unit and actually get the vaccine. So all that's worked really well. It's been a lot of planning, and today's been very successful. I think it's been successful because we've had management support and executive leadership support throughout, and we'll continue to run the campaign throughout the rest of the season and have other clinics available and continue to support the rest of our staff to do the right thing for our patient. I think
All right, so thanks for coming in. This is the vaccine information sheet about the influenza vaccine for this year. All right.
Has this been a successful campaign for you?
It has. Trying to make it picture perfect. All right, there's going to be a squeeze. 1, 2, 3. And you are done.
Can you talk to me about the program you have here at your organization for vaccinating your staff?
At our organization, we believe strongly that having flu vaccine really protects our patients, and that it's the right thing to do for our patients, for their loved ones, and for each other. So we started a leadership team here at our hospital as 100% either vaccinated, or we have one who has a medical exemption.
Okay. And currently, where are your rates?
Currently, our rates are 72%. And that's vaccination and exemption. The exemption is a very small portion of that. So one of the things we do to really strongly encourage people to get vaccinated is we do provide the flu vaccine free of charge to employees, and to physicians, and to our volunteers, as well as our board members. So we even extended that far because we believe so strongly in this. One of the areas we've been most challenged with in the past is our support services departments. And so this year we actually set up a clinic down on the first floor, which is where most of their home base departments are located. And we have been able to increase the vaccination rate among environmental services, food services, resource distribution, central sterile processing considerably this year. I'm really, really proud of the way all of those teams have come together to rally around the patients by getting vaccinated.
Okay. Do you have anything to say, if you could encourage anyone about getting the vaccination?
I think, you get the vaccination. The reason I get vaccinated is because I want to protect our patients. And I'm not someone who's out there. I'm not a clinician by background, so I'm not out on the front lines providing patient care, but I work in a hospital. And when I'm making rounds, I'm interacting with patients, with visitors, and in all of the meetings with staff. And I don't want to, if I got the flu, then pass that along to someone else. The other thing is that, I have seen and met and spoken with patients who were young, healthy patients, healthy people out there leading a normal life and have gotten the flu. And we had one patient who's shared an experience about getting the flu and, ended up in intensive care and nearly died. And so it doesn't matter what age you are. I think there is a misconception out there that only the very young or only older people need to get this vaccine, and that's not the case. Everyone needs to get it, especially when it comes to protecting patients.
The story we've just heard is, by their own account, a success story. To date, they have vaccinated 78% of their staff. The reality is, it is still shy of the 90% vaccination requirement to achieve herd immunity. The time to act is now. We should not face one more flu season without a mandate for the seasonal influenza vaccine for all direct healthcare providers. The cost of failure to act is a failure of our healthcare system to protect our public and a failure to provide safe, quality care.